Hello and welcome. Let's talk today about cardiovascular system. And we'll start by talking about one component of the cardiovascular system, which will be the heart. Now, when we talk about this cardiovascular system is made up of the heart, it's made up of blood vessels, and it's made up of blood. So when we go through and we talk about the function of the cardiovascular system, the function of the cardiovascular system is to provide the body's cells with oxygen-rich blood and then to return this oxygen-poor blood back to the heart to where it could get pumped to the lungs and it can get reoxygenated. So when we talk about the components, first we have blood. Blood is going to be the actual transport medium. This will be the component that will contain the components that we're trying to move around. Next, then we have the blood vessels. The blood vessels are the delivery routes. And then the heart, you can think of the blood vessels like the freeways, right? And then the heart is going to be this whole transport system's pump. It will be this whole transport system's pump. So let's go through and let's talk about the heart then. When we talk about the heart is about the size of our fist. It's about the size of our fist, right? Weighs about 250 to 350 grams, less than a pound. Now, when we listen to the heart sounds, when we hear heart sounds, those heart sounds are made by the closure of the valves. It's made by the closure of the valves. The heart is found located enclosed within the mediastinum. If you recall the mediastinum we've talked about in the beginning of the semester, the space found in between the two pleural cavities, which is also subdivision, you can say, are all subdivisions of the thoracic cavity. The heart's found orientated, extending obliquely, as we can see here. It's found extending obliquely for about 5 inches from the second rib down to the fifth intercostal space. So the second rib down to then the fifth intercostal space, you can see here. And between, you can see at that fifth intercostal cartilage. Now it's going to be found resting on top of the diaphragm. It rests on top of the diaphragm. Found located, right, posterior to the sternum and anterior to the vertebral column. Anterior to the vertebral column and posterior to the sternum. When we talk about the apex of the heart is going to be found pointing inferiorly towards the left hip. It's found pointing inferiorly towards the left hip, as we can see here. And here is where then the apical impulse is felt, or also known as the point of maximal intensity. This apex is formed by the left ventricle. It's formed by the left ventricle, and you can see that there very nicely. Here's the apex, here's the left ventricle. On the right, you can see just blending right into that. So the left ventricle is forming that apex right down here. Next then there's the base. Opposite to the apex is going to be the base, back up here. The base is directed towards the right shoulder. It's going to be directed towards the right shoulder. Right? You can see that right in here. Here's the base. It's directed towards the right shoulder. Next, let's talk about the coverings. Let's talk about the coverings in relation to the heart. The covering is known as the pericardium, as we have been talking about since the beginning of the semester. Here we can appreciate the pericardium. Here we can see we've zoomed in on the pericardium. What we'll do is we'll zoom in even further on this picture, and that's what we're seeing right in here. So we talk pericardium. Pericardium is a double-walled sac that encloses the heart. First you have what we call the fibrous pericardium. Let's talk about this fibrous pericardium we see right outside of here. This fibrous pericardium is going to be the loosely fitting superficial part. It's a loosely fitting superficial part. It's tough, and it's dense connective tissue, and it protects the heart, and it anchors the heart. You can see here, it anchors the heart to the surrounding structures, and it's also going to prevent the heart from overfilling with blood. It will prevent the heart from overfilling with blood. Then beneath it, we can see what we've learned before, the serous pericardium. Now, the serous pericardium is a deeper layer. It's thin, it's slippery, and it's a two-layered serous membrane. You have first the parietal pericardium. You can see right down inside of here. This parietal pericardium, it lines the internal surface of the fibrous pericardium. And it also attaches to the large arteries that are exiting the heart at basically the superior margin of the heart. Next, then we have the visceral pericardium. The visceral pericardium is the inferior continuation of that parietal layer. It's the inferior continuation, the visceral pericardium. So it's the inferior continuation from the large arteries over the external heart surface. It's also known as the epicardium, aka epicardium, which we're going to see in a few seconds is an integral part of the heart's walls, of the heart's wall. So here we can see then between the two is this pericardial cavity. The pericardial cavity is a slit-like space between the parietal and visceral layers. It's a slit-like space between the parietal and visceral layers. And it's going to contain a film of serous fluid. It will contain a film of serous fluid that's going to allow the heart to function friction-free. It will allow the heart to function friction-free. So then let's check out the wall layers then. When we talk about the wall layers, we'll see the layers are going to be richly supplied by blood vessels, and the layers are made, basically 3 layers make up the heart's walls. So the walls are made up by 3 layers. First we have, again, this epicardium. The epicardium is the more superficial layer. We said it's also known as the visceral layer of the serous pericardium. This epicardium is going to be infiltrated with fat in the elderly. It gets infiltrated with fat in the elderly. And you can see that in our cadavers when we open up our cadavers and we dissect the pericardium, the heart out of the pericardium. You're able to appreciate that adipose on there as well. Next then is the myocardium. So epi, the prefix, use that to your advantage. Myo, same thing, right? Myo, we're talking about now. This muscular layer, this layer that we have right in between basically the most superficial layer and the deeper layer. So myocardium, muscular layer, cardiac muscle is what we have right inside of there. Right? You can see it forms the bulk of the heart. And this is the layer that actually contracts. This is the layer that actually contracts. Next, then we have the endocardium we can see inside of here. When we talk endocardium, the endocardium is the 3rd layer. It's a glistening white sheet of endothelium. Remember we talked endothelium. Endothelium is simple squamous epithelium. And it's going to be found resting on a thin connective tissue layer. It's located on the inner myocardial surface. The endocardium is. And it lines the heart chambers and covers the fibrous skeleton of the valves. It lines the heart chambers and covers the fibrous skeleton of the valves. When we talk about the muscular layer, we'll see it's made up of 2 major cell populations. First, we have 99% of them will be your contractile cells, and then 1% will be your autorhythmic cells. And we'll see how they're all connected to each other as well to allow the heart to beat in this nice coordinated fashion. So let's move then to the chambers of the heart. Let's talk about the chambers of the heart. Here we can appreciate the chambers of the heart now. So here when we go through and we talk about the chambers of the heart, we'll see the heart's going to have 4 chambers. We'll have 2 atria and 2 ventricles. You can see them right inside of here very well. 2 atria are going to be found as the superiorly located chambers. And then the 2 ventricles are going to be the more inferiorly located chambers. Now, the atria have auricles in relation to them. These auricles are going to be ear-like structures. They're small, wrinkled, protruding appendages. They're found protruding from the atria, as we can see here. Next, then we have the internal structure. The internal structure we can see here is the interatrial septum. This interatrial septum, the name is telling us everything there, is going to be an internal partition. It divides the heart longitudinally, separating the atria. Separating the atria. Next, then we have the fossa ovalis appreciated here. The fossa ovalis is going to be a shallow depression. It's a shallow depression, and it marks the spot where an opening once existed. The opening existed in the fetal heart. The opening was called the foramen ovale. The foramen ovale. This fossa ovalis, now we can see here, we'll move over to this slide here and we'll draw out basically what we have here. It's a pretty neat structure. So here we'll say we have the heart. Excuse my drawing, I'm not an artist and this pen doesn't make it easier. Let's do this. So we have the interventricular septum, and then here we have our interatrial septum. So this is what this looked like before. So this was open here like this. Okay, so this foramen we had here allowed basically blood coming from mom, from this umbilical vein, come in and make its way into this right atrium. From this right atrium, normally speaking, blood would be routed into this right ventricle. From here, it would go to the lungs. But in this fetal circulation, while we're in utero, the lungs aren't expanded. We're not breathing on our own. So here, this blood that comes in from mom makes its way in. It's oxygen rich, and it crosses right over. How convenient, how awesome. Makes its way to the left side so it can be distributed throughout the body. But then once we come out, pressure changes, we take our first breath, all of this snaps shut. This all snaps shut. And we don't have an opening here. Pressure on this side is higher because the lungs have opened up, so it causes this to snap shut. So then that's what we're left with, is that depression. And that's what you're seeing here. Fossa ovalis. We also have here what we call the coronary sulcus. The coronary sulcus, we can appreciate out here, is also known as the atrioventricular groove. It encircles the junction of the atria and the ventricles like a crown, and as you can see, it contains important blood vessels. Let's move into the chambers in greater detail. Let's talk about the right atrium. Now, when we talk about the right atrium here, we could see the right atrium is going to receive blood from 3 different sources. And we'll go through all the different sources. And it has 2 basic parts to it. First part is the smooth-walled posterior aspect. And then we'll have an anterior portion, which you can see the walls are going to be basically ridged by muscle tissue bundles. And these muscle tissue bundles are going to be called pectinate muscle. Pectinate muscle. Now, we said it receives blood from 3 different sources. So this right atrium receives, number 1, you can see oxygen poor blood from the superior vena cava. You can see how it opens up into this right atrium. Here, the superior vena cava is going to dump oxygen poor blood, okay, or deoxygenated blood from body regions above or superior to the diaphragm. Now, the inferior vena cava, we can see down here, is going to be responsible for returning deoxygenated blood, oxygen-poor blood, from body areas below the diaphragm. Below the diaphragm. And then third, we will have our, you can see right in here, coronary sinus. Coronary sinus is going to dump its blood, which it's going to receive from the heart now, myocardium of the heart, into the right atrium as well. So oxygen-poor blood coming in, you can see here, 3 different ways. Next then we have the left atrium. The left atrium now receives oxygen-rich blood, and it receives oxygen-rich blood via the 4 pulmonary veins. Here you can see 2, and here's the other 2. These 2 empty right into here also. Next then we have our ventricles. Our ventricles. When we talk about the ventricles then, we can appreciate the ventricles just inferior to the atria. And these ventricles we can see now are going to be, so when we talk about the ventricles we can appreciate as chambers found just inferior to the atria. Now here we have our two ventricles. Our ventricles are located inferior to the atria, and they make up most of the heart's volume. They make up most of the volume of the heart. We also have a septum here as well. This is the interventricular septum. You can see here, separating the ventricles longitudinally as well. Now, when we talk about this septum and both these septums, you can see they're going to be internal partitions. So internal partitions. Next thing we have our anterior interventricular sulcus. Our anterior interventricular sulcus. So when we talk anterior interventricular sulcus, you can see right here. It's going to be found basically cradling the anterior interventricular artery and the great cardiac vein. And it's basically marking the anterior position of the septum separating those ventricles. And going to the back of the heart, you have the same exact thing back there. When we talk about the back, now we're going to have the posterior interventricular sulcus. It's continuous with the anterior, and it also contains important blood vessels here. Middle cardiac vein, and you can see the posterior interventricular artery. So let's move back to the inside. Now moving to the inside here, we can appreciate Trabeculae Carney. Now, when we talk Trabeculae Carney are going to be irregular ridges of muscle that are going to be found protruding. Irregular ridges of muscle protruding right off the surface of the internal walls. And these irregular ridges of Trabeculae Carney is going to further protrude, we'll see, as the papillary muscles. So these papillary muscles we can see here now, they actually play a role in valve function, and they project into the ventricular cavity. Now the right ventricle makes up most of the heart's anterior surface. It makes up most of the heart's anterior surface. The right ventricle pumps blood into the pulmonary trunk. Right? From the right atrium, it pumps blood into the pulmonary trunk. The pulmonary trunk then receives this oxygen-poor, deoxygenated blood, right? And it's going to route this blood to the lungs, where gas exchange is going to occur via the pulmonary arteries, which you see right here. Next, then we have the left ventricle. The left ventricle makes up most of the posterior inferior surface. And as we said before, it forms the apex of the heart. And it routes oxygen-rich blood that it receives from the left atria into the aorta. So when we talk about the pathway of blood through the heart, you can think of the heart as being two pumps side by side. Right side, the right atria receives oxygen-poor blood, right? We talked about from where? And pumps that oxygen-poor blood into the right ventricle. The right ventricle pumps this oxygen-poor blood into the pulmonary trunk. Pulmonary trunk pumps this blood then, routes this blood then into the pulmonary arteries, then into the lungs. From the lungs, oxygenated blood comes and returns to the heart via the pulmonary veins. There's 4 of them. Here you can see them. They all open right into the left atria. From the left atria, this oxygen-rich blood makes its way into the left ventricle. From the left ventricle, this oxygen-rich blood makes its way into, we said, the aorta, to be routed into our circulation. We can also look at all of these blood vessels and the circulation and divide it up into 2 circuits, the pulmonary circuit and the systemic circuit. So here you see the same thing as you're seeing here. The pulmonary circuit is made up of blood vessels that are responsible for routing blood to the lungs and back. To the lungs and back. So you could think of this circulation as circulation that's responsible for gas exchange. Next, then, we can see we have the systemic circuit. The systemic circuit is going to be made up of blood vessels that are going to be responsible for routing blood to and from all body tissues. To and from all body tissues. Let's talk about the valves. Let's talk about our valves. Now, when we talk about the valves, here we can appreciate we're going to have 4 valves. Here you can see those valves. Here we can appreciate those valves. Here we can appreciate those valves. Here you can appreciate a couple of them. The atrioventriculars. And here we'll see how the valves are gonna enforce blood flow, just like any other valves do, right? In the GI tract, you guys saw valves doing the same thing there as well. So here's all the blood flow through the chambers and everything there you should know. So here, let's go through and let's look at these valves from this picture here. All right, so here we can see now, there's 4 valves. They're gonna do just like what other valves do. They enforce flow. Here they're enforcing blood flow to the heart. These valves, you need to know, are gonna open and close in response to pressure differences. So this valve here, let's say for example, this valve is going to open when the pressure is higher on this side versus this side. The valve will close when the pressure is higher on this side versus this side. Same thing here. Pressure higher on this side compared to this side will cause this valve to open. Now if we have pressure higher on this side versus this side, that'll cause this valve to close. So valves are going to open and close in response to differences in blood pressure. You have your first 2 valves, the atrioventricular valves, you can appreciate here very nicely. The atrioventricular valves, 2 of them, one located at each atrioventricular junction. And what they're going to do is they're going to prevent the backflow of blood into the atria when the ventricles are going to be contracting. First, you have your tricuspid valve. The right AV valve has 3 flexible cusps, flaps of endocardium that are going to be reinforced by connective tissue cores. Next, you have your mitral valve. Mitral valve is the left AV valve and it has 2 flaps. And these valves, you can see, have chordae tendineae to them. These chordae tendineae are tiny white collagen cords that are going to attach to each valve flap, that attach to each AV valve's flap. And what they're going to do is they're going to anchor the cusps of the valve. They're going to anchor the cusps to the papillary muscle that we saw before. Anchoring the cusps to the papillary muscle. That's the job of the chordae tendineae. So you go here, you talk valve, right? The cusps of the valves, chordae tendineae, papillary muscle, and then Trabeculae Carney. You can see everything in order. Next then, we've got our semilunar valves. And you see here why we call them semilunar valves. Semilunar valves, they guard the bases of the large arteries that are issuing from the ventricles. So you have a aortic and a pulmonary, which are going to be found at the aortic base and at the base of the pulmonary trunk. So when we go through and we talk about these semilunar valves are going to prevent the backflow of blood into the ventricles. Each has 3 pocket-like cusps. Each is going to have 3 pocket-like cusps. Where's the third one here? What's the one that would be right on top, right? That's the one we've taken off. You see it just like that. In the cadaver, you see them really nicely also. So pulmonary, right semilunar valve, pulmonary valve, aortic valve, or left semilunar valve. So we've taken care of everything here inside. We looked at everything here on the outside, except for these blood vessels. Let's look at the circulation then. Let's look at the coronary circulation. So here what we'll do is we'll isolate just the coronary circulation. And here we can see that first from here we'll start. We talk coronary circulation. It's a functional blood supply of the heart. It's the shortest circulation in the body. And it's going to be provided by the right and left coronary arteries. The right and left coronary arteries. So if I was to ask you, what are the first major branches off of that aorta? You would not answer brachiocephalic trunk. You would say your coronaries. So here you can see right coronary and then left coronary. Now when we talk right coronary and left coronary, right coronary artery courses to the right side of the heart, where it gives rise to two branches, two major branches. There's more branches you'll learn about in the lab. Right, the first major branch is the right marginal branch, the right marginal artery. Now the right marginal artery is going to be responsible for supplying the myocardium of that lateral right side, of this lateral right side. And you can see here it continues to the dorsal aspect as the posterior interventricular artery. Posterior interventricular artery. And that runs towards the apex of the heart. Runs towards the apex, supplying the posterior ventricular walls. It's a very important vessel there. Shortest circulation, we said. The left coronary then. Here you can see the left coronary. It runs towards the left side of the heart. Runs towards the left side of the heart where it divides, it branches into the circumflex artery, which we're going to see going towards the back, and then the anterior interventricular artery, also known as the left anterior descending or the widowmaker. So here we can see this anterior interventricular artery. The anterior interventricular artery follows the anterior interventricular sulcus, and it supplies blood to the interventricular septum and the anterior walls of both ventricles, you could see. The circumflex then supplies the left atrium and the posterior walls of the left ventricle. Let's look at the venous return. When we talk arteries, I want you to think of vessels that branch and divide. When we think about veins, we're going to think about blood vessels that converge and merge. So here, you have one major vessel, it branches and it divides. And the one major blood vessel branches and divides. Same thing here. But here, veins, we're going to see all of these veins we see are going to converge. They're going to come together and they're going to give rise to this one vein here. Just like in the body, all of our veins come together to give rise to the two major veins, superior and inferior vena cava. When we talk arteries, we start with the one artery, the aorta, and then from there we have all these branches and divisions from there. So that's how you have to think of that. When we talk veins, the cardiac veins are going to collect venous blood, which is passed through the capillary beds of the myocardium. And this path will follow the coronary arteries, follows that of the coronary arteries. These veins join to form an enlarged vessel that's called that coronary sinus that you see there very nicely, which is going to empty its blood that it receives from the heart, basically the myocardium, into the right atrium. This sinus has three tributaries, three major components that form it. First, you can see great cardiac vein. The great cardiac vein is responsible for draining blood, you could see, from the anterior aspect of the heart. It's running in the anterior interventricular sulcus. Then we have the middle cardiac vein. When we talk middle cardiac vein is going to be found in the posterior interventricular sulcus. Posterior interventricular sulcus. And then here we have the small cardiac vein. Small cardiac vein runs along, you can see here, the heart's right inferior margin, collecting blood from this lateral aspect. And then here you have these anterior cardiac veins, smaller collateral branches, basically all emptying and helping to form then this coronary sinus. So the three main tributaries you can see we've gotten right inside of here. So there we've taken care of outside and inside. Here you can see again those pulmonary veins. From here the picture looks deceiving, but here you see they're emptying right into that atrium, the left atrium. Same thing you see here. They all come together just like this. From the front, you usually see them from here. Let's move to then heart excitation. Let's talk about the conduction system. Now we talk about the conduction system. It's going to be made up of a few different components. Let's go through these components and check them out. Here you can appreciate the details of how they're going to make their way up all into these papillary muscles and make sure every component is getting supplied that needs to be innervated basically from these fibers. So here we can see I told you the heart's made up of two different types of muscles. They're going to be connected to each other via gap junctions. Now we talk nerve supply. That's the major supply, right? Nerve supply to the heart. If we were to cut the heart out, put that onto the table, that conduction system is what's going to keep the heart contracting. Now we also have our own system, the sympathetic and parasympathetic, our autonomic nervous system, which then has an influence on this heart and it modifies the heart rhythm. So here we can appreciate the intrinsic cardiac conduction system. It's made up of, you'll see a few components, we'll go through them. This is the only connection between the atria and the ventricles. There's no gap junctions between the atria and the ventricles. Those gap junctions are going to be found in between the cells of the atria and then also in between the cells of the ventricles. So the only connection between the atria and the ventricles is going to be basically this connection we see here. So first we have the SA node. The SA node is found on the superior aspect of the right atria. You could see right at the entrance of the superior vena cava. Now this SA node is known as the pacemaker because it sets the pace at which the heart will beat. And if it had no influence by our body, by the hormones and by neural influence there, it would have the heart basically beating at about 100 times a minute. So that influence by the body slows it down to about 75 times a minute, we say, right? Anywhere from 60 to 80 beats a minute. Now, when this SA node fires, when it sends off an impulse, those impulses are going to travel through this internodal pathway to the AV node, and also they're going to travel through another pathway that allows them to make their way over to the left atrium, and that's called Bachmann's bundle. So they'll pass via Bachmann's bundle to the left atria as well, these impulses. These impulses will pause here at the AV node for 0.1 second. And that's going to be to allow the atria to contract as a coordinated fashion, to contract together. Next in here, we're going to see the impulse is going to travel from this AV node. So the AV node is found at the inferior aspect of that same chamber, right, of the right atrium, right near the junction of the atria and the ventricle. So the AV node then receives that impulse and it directs that impulse through the atrioventricular bundle, or the bundle of His. This is also known as. So the impulse travels through then the right and left bundle branches. The right and left bundle branches then are going to allow those impulses to travel all the way through, as we can see here, up into the Purkinje fibers to allow the ventricles then to beat in a coordinated fashion as well. So now if we were to look at the two bundle branches, if we were to have a block in this left bundle branch, that'd be quite serious because this left side has an important job. That's to route oxygen-rich blood up into the aorta versus the right side. I mean, it's important there as well, but it's not going to be as important because we'll see here blood is going to be, it's a shorter circulation on this side compared to this side, and blood is going to be routed basically right inside of the pulmonary trunks, and from there gravity will kind of also play a role and help it to kind of make its way forward. So this is our intrinsic conduction system. Next in here, we talked about some changes. Let's talk about then auscultating the valve. So if you wanted to listen to the valve, these are the different areas you would place your stethoscope. If you were to place it just directly in the middle, you're going to listen to everything together. So this way, what you do is you isolate each of the valves. You go upstream and you go downstream and you listen to them individually. You will do this in a physio lab. And here's some diseases I want you to know about as well. Coronary atherosclerosis is basically those coronaries becoming blocked up, and when they become blocked up, this can lead to myocardial infarctions. And there then what we have to do is either go in and put a stent if we can, or do a bypass and bypass that blockage, basically like this. If we see the blockage is, let's say, right inside of here, we'll do a bypass where we'll get another vessel, sew it up basically to here, and then sew it up down here as well, bypass that blockage and allow that blood to make its way down here and continue to perfuse the tissue down here. And that's a single bypass. A double bypass is 2 vessels. Triple bypass, that is obviously more serious, 3. And then quadruple is obviously 4. And, just keeps going and going. Now, when we talk about categories of heart diseases, I want you to go through these and know basically how they're all classified there as well. Congenital, myocardial hypertrophy or degeneration, inflammation, and then valvular defects, and then cardiac tumors, to name a few categories there.